hi there. Come on in. Sorry about that, I was just checking up on my notes. My name is Doctor Periwinkle. It's nice to meet you. Is this your first time coming into the clinic? Yeah, I thought so. Not to worry, it's fine. I can just take down your details. So, thank you for coming in today. Basically, what today is all about is we are offering free flu jabs to everyone in the clinic. Everyone who's signed up to this practice. Is that something you might be interested in? Maybe. Perhaps I can convince you. Yeah? Okay, so we do this every year. We have kind of we run like an event where between October and January we really try to get the flu shot out to as many of our patients as possible. We do this because, the weather is the harshest during these few months and a lot of people are going to catch the flu. So we just try to prevent as many cases as possible. Okay? Are you on the fence? Okay, well, not to worry. I can talk you through some of the information I have. That'd be okay. Good. Before we get into that, is it okay if I just take down some of your details, your name, date of birth, etc.? Good, thank you. So, could I take your name, please? Okay. Your date of birth. Okay. Your address. Okay. And the name of your previous doctor and your previous practice. Okay. Good. And how long were you with them? All of your life? Okay. So have you just moved into the area? Okay, cool. That's fine. So have you had any vaccines before? Do you remember when you were a child perhaps getting the measles, mumps and rubella vaccine? You do? Yep. Do you remember getting hepatitis A and B vaccine? Yep. What about chickenpox? Oh, you had chickenpox, did you? Okay. And have you ever had a tetanus shot? Okay. Have you had the flu vaccine before? You haven't? Okay. And have you ever caught the flu before? It's usually more severe and long-lasting than the common cold, but here's a virus that clears within 2 or 3 weeks. Symptoms will be blocked nose, sore throat, coughing, headaches, all sorts of things that make you feel poorly, similar to the common cold, but usually a bit more severe. It can develop into complications such as bronchitis and pneumonia, which is why we really try to prevent it as much as we can, because whereas the flu itself, it can clear up on its own, pneumonia and bronchitis, they can't really, so we try to prevent it all. Okay, so are you open to hearing just a little bit about the flu vaccine and why we recommend it? You are? Fantastic. Before we get into all that, if I just give you a little warning, you might hear some bangs or unpleasant noises. Basically, we're expanding our practice to include a psychology department, so there are builders on site. It's quite annoying, I know, but in the long run it's going to be fantastic because we'll be able to offer a greater range of therapies, especially for those with mental health needs, which is something that we can all look forward to. Okay, so we recommend the flu vaccine for basically vulnerable groups of people. So this is the elderly, over 65, children as well, anybody with a physical disability or a learning disability, anybody who lives in a residential home, or even people who work in a residential home, people who work in hospitals, or people who spend a significant amount of time in hospitals because of chronic illnesses, people who have asthma, diabetes, heart disease, liver disease, or a weakened immune system for some reason or another. So these are all groups that are quite at risk of catching the flu, and if they do catch the flu, it's more likely to lead on to more serious consequences and complications like pneumonia and bronchitis, like we said. In someone like yourself, someone who's quite healthy, your immune system probably could fight the flu off quite well on its own, but we still recommend the flu shot anyway. Have you ever heard of herd immunity? Herd immunity. So basically, this is when we want to protect those few people who can't get the shot for one reason or another, perhaps religious reasons, perhaps they don't know enough about it, perhaps they're allergic, one reason or another they are not able to get the shot. So what we do instead is we make sure that as many people as possible from the general population do get the shot, and this means that the virus itself is less able to spread. So if you think there is one person who is quite weak, quite poorly, allergic to the vaccine, and then they've got 10 people around them, if 5 of those people get the vaccine and 5 don't, then those 5 people could still pass on the virus to that one person, and it could be a life or death situation for that one person. Whereas those 5 that caught the disease and they were able to fight it off, if it passes on to that one weak person, they may not be able to fight it off. Whereas if all 10 people around them were vaccinated, then that virus has no chance, or much less chance, of getting to that one person. So essentially it's going to save that person's life. Does that make sense? So herd immunity really is the only way of protecting those really vulnerable people in society. All clear so far? Good. Do you have any questions? How do vaccines work? Okay, that's a great question. So basically, vaccines take a very small amount of the virus or the bacteria and we inject it into you, but first that small amount has been weakened or damaged or even destroyed in a laboratory environment. So it's not as potent, as powerful, or as aggressive. It's really quite a weak version of the virus. So in this case, it's a weak version of the flu. Now, when this enters into your body, your immune system is going to learn how to fight it. It's going to create antibodies, and they're all going to gang up on that virus and destroy it and teach your body how to fight it off in the future. So once your body has learned how to do this, it can do this for years to come. So catching the flu is another way to create those antibodies, but it's going to be a harder struggle between the antibodies and the virus. It's going to be a longer struggle, much more difficult for the antibodies to overpower and fight off the virus, which could take weeks. And during this time, you're going to be getting all those nasty flu symptoms that are going to make you feel very poorly, have to miss work, etc. Whereas your body can learn to do it exactly the same way, but much more effectively, if the antibodies are fighting against the tiny little amount of the virus that we have in the vaccine. Does that make sense? Good. So it's much safer, much quicker, much more effective for your body to learn how to protect yourself when we're using the vaccine rather than actually catching the disease. Sounds good, right? It does. Do you have any more questions? Side effects? Yes, there can be. For the majority of people, you'll get no side effects. Sometimes you might feel some soreness, some redness, some itchiness, tenderness, weakness in the injection site. So this will be in your arm. You might get a little bruise there, kind of like a red dot. It can take a little while to go away. You might get a headache, you might get a cough, you might get a sore throat, but it's going to be a lot milder and a lot less. It's going to be shorter as well than getting the flu. Whereas the flu could last 2 or 3 weeks, the side effects could last 1 or 2 days, and they're going to be much easier to deal with. Most people don't get side effects anyway, but if you do, just rest assured that it won't last long, it will go away. It's just the reaction from the small trace amount of virus in the vaccine and your body's way of fighting it, which can produce the symptoms. So, what do you say? Have I convinced you? Fantastic. I'm really glad to hear that. Okay, so if I just do a few tests on you just to check that you're currently healthy enough to receive the vaccine at this time. So this is just going to be your temperature, your blood pressure, listening to your heart and your lungs. Okay, and then we can go ahead and give you the vaccine. Now today the version I have is injection form, so how are you with needles? Okay, right, don't worry too much about it for now, but when it comes to it, we'll try and make it more comfortable for you. Okay, lovely. So if we can start with your temperature. Okay, so the thermometer I have is an oral one, so it's going to go in your mouth just beneath your tongue. Okay, good. Just going to pop some gloves on. So how are you feeling in yourself at this moment, or for the last few days? You feeling quite healthy? Good. Okay. So I have this one. So is that okay if we pop it in? Perfect. Okay. Just gonna press the button. Just give it a few minutes, okay? A few seconds. It's just gonna come up with a number for me. Okay, Okay, good. That's 37.4, which is perfectly normal, perfectly in range of where we like it to be. Perfect. Okay. So, what should we do next? Your blood pressure? Yeah. You've had your blood pressure taken before, I take it. Good. So you know what this is all about. Good. Okay, so basically this cuff, is going to wrap around your arm, and I'm going to use this pump to blow it up. You're going to feel some pressure around your arm as the cuff kind of squeezes, but that's normal and it will only last a few seconds and then it will deflate. And while it's inflated around your arm, I'm going to be having a look at your blood pressure on this device. It will show me what number it stops at, okay? Good. There's a specific kind of range that I'm looking for, but I won't bore you with that for now. Okay, so if you want to hold out your arm, that's it, and if you could roll up your sleeve. Perfect, I'm just going to wrap it around for you. Okay, we'll start pumping it up now, okay? Okay, that will do. Yeah, if you could just relax. Okay. Yep, and it's going to start to deflate now. Good. So that was normal, and that's fine. We'll just get that off your arm. Okay, and we don't need that now. Alright then, so if I can listen to your heart now, and also your lungs. So when I listen to your heart, if I could just ask you to be very, very quiet and very still, because I'm going to try and count your heartbeats for approximately a minute, okay? And when we do your lungs, I'm going to ask you to take a deep breath in, deep breath out, so that I can just check that you've got no fluid in your lungs. Okay, perfect. Normally we get the nurses to do the flu shots, but I had some free time today, so I thought, why not do it myself? You ready? Could you unbutton your shirt? Perfect. Okay, so we'll do your heart first. Okay. I counted 64, which is really good, really just we're looking for anything between 60 and 100 beats per minute, but the closer to 60 the better, because that means you have a nice strong heartbeat. Yeah, and a really healthy heart as well. Perfect. So if you listen to your lungs, I'm going to have to do this on both sides, okay? So we'll start with this side, and I'm going to ask you to breathe in, breathe out a couple of times. Yeah, good. Okay, deep breath in for me, and deep breath out, big breath out. Okay, and again, deep breath in. Yep, nice and long. Okay, and breathe out very slowly. Breathe out, breathe out, breathe out, breathe out. Good. Okay, one more time. Try and breathe in as slow as you can. So I'll slowly count to 8. If you could try to breathe in as slow as possible, and then breathe out as slow as possible. So we'll try and do it for a count of 8. Okay? Okay, inhale. 1, 2, 3, 4, 5, 6, 7, 8. Okay, and exhale. 1, 2, 3, 4, 5, 6, 7, 8. Okay, lovely. If I go around the other side. So that was good. And we'll do this side. More or less the same. So if I ask you to breathe in normally, and then breathe out normally. Good, yeah, through your mouth. Breathe in nice and deeply. Deep. Deeper. Yep, that's it. And breathe out slowly. Good. Okay. We do it one more time. This time like we did before, for a count of 8. So inhale. 1, 2, 3, 4, 5, 6, 7, 8. Yep, and then exhale nice and slowly. 1, 2, 3, 4, 5, 6, 7, 8. Perfect. That's good. My hair always gets stuck in this, so I end up pulling out loads of chunks of hair every time I take it off. But that's all we need it for now. So you do seem quite healthy. So if you're ready and if you feel okay too, we can get on with the actual flu jab, the flu shot, depending on what you call it. Okay, so which hand do you write with? You're right-handed. Okay, so do you want to give me your left hand? Is that going to be easier for you? It's up to you which side, really. Should we go with the left? Okay, yep, that's cool. So what I'm going to do first is just use one of these wipes just to give the area a quick cleanse. Okay. So this isn't going to sting or anything. It's very mild. You could just make sure that sleeve is all the way up for me. That's it. I'm just going to place this on your arm. Okay, it's just a bit cold, but it's not going to sting. It's very gentle. vacuum packed in a little packet, so it's completely sterile, completely clean, straight from the lab. It's not been touched. This means, and of course I've got gloves on, this means that there is no way that we're going to introduce any bacteria or viruses into your blood apart from the one in the vaccine. Okay? So, just going to open this up. Okay, so I'm going to suggest to you, because you told me that you were feeling a bit unsure about this, I'm going to suggest that you look away. Okay? Just hold your arm out for me. Okay? Right. I'm just going to try and find a nice vein. I can feel that you're tensing your arm. You're still quite nervous. When was the last time that you had an injection? Years ago. Okay. And did you have any kind of negative experience with that? Yeah. What happened? Okay. So how did that make you feel? Quite weak? Okay, well, I mean, if you end up feeling like that today, if you end up feeling faint, we'll deal with that. You can stay here for as long as you need to. We're not just going to send you on your way, okay? Okay, but for now, be good if you just relax your arm. If your arm is quite tense, then the vaccine is going to struggle to flow through your bloodstream gently, and it's going to be a bit of a battle against your body. Kind of, it's like putting up a barrier. Yeah. So just take a deep breath, and as you breathe out, imagine your body just letting those barriers down. I'm not going to say that it won't hurt at all, but you should probably just feel just a little prick. It's just going to be like a little pinch, okay? The needle is very small. The tip of the needle is very small, and it's very fine, like a very thin tip. And it's only about an inch long as well, and not all of that will need to go into your skin. Okay, what was the last injection that you remember having? The hepatitis B one. The needle for the hepatitis B is a lot bigger, and it needs to go in a little bit deeper because basically the vaccine, there's more of it. So we only have 5 mils today. The hepatitis B one was more. So that's why it might have been a bit more uncomfortable for you. But this one should be okay. You ready to give it a try? Okay. So relax your arm for me. We'll do one more breath. Deep breath in. And deep, nice long, slow breath out. Good. Okay. So, if I would look away, you don't need to look. We're not in yet, don't worry, we're not in yet. So, you going on holiday this year? Where are you going to go to? That sounds good, that's exciting. Have you ever been there before? Yeah, I've never been, but I hear that it's really nice there. Really, really warm. Well, I hope you have a really great time there. Okay, and we're done. Did you feel that? Okay, I'm just gonna get you a tissue to hold over there for a second. Okay, just hold it down there. Just as a few drops of blood. How did that feel? Not as bad as hepatitis B1. Good, good. I find that if you don't watch, if you look away, if you think about something else, so that's why I was asking you about your holiday. Think about something else, and then you don't feel it as much. Yeah, it usually works for my patients. Asking about their holidays is kind of my go-to. Always does the trick. Okay, so you can sit here for as long as you need to get yourself kind of balanced, centered, feeling like you're okay again. Take as long as you need. Okay? Are you feeling a bit faint? Okay, no, don't worry at all, don't worry, you're not a burden. Just, right behind you, there's a bed. Do you see it? Yep, just take a lay down on that. Here, I'll help you up. Take onto my hand. Good, okay. Yep, go lay down on that bed. Good. Okay, you can just close your eyes and just breathe. Some people do feel a little bit faint afterwards. It's not necessarily the vaccine or the injection itself, it's just the anxiety around needles, the anxiety around having something foreign enter you, but you'll be okay. Take as long as you need. Just relax, you can stay as long as you need to. Good. Okay. When you're ready, whenever you're ready, no rush, just slowly sit back up again. Yep. Okay, and slowly look around the room. Look over to the left, look over to the right, look up and look down. You okay? Yeah, you feeling better now? Okay, fantastic. Okay, so thank you for coming in and agreeing to have the shot. You could have potentially just saved someone's life, and at the very least you have safeguarded yourself against catching the flu for at least another year. So sometimes, you will need to come back in next year if you want to be protected again. The flu it's very clever. It does update itself. Every year it releases new strains and it tries to trick us really. So every year we're creating more updated vaccines. But for now, you're going to be fine, okay? Perfect. I'll see you again next time. Have a good day. Bye.